So this is a quick self-massage lesson. So many people dealing with headaches. It's jaw, temple, eye, kind of around behind the ear, and this jawline. So gentle pressure, using a broader area of your fingers, the flat part is going to be more gentle. So that's good. And to start, we just want to have some broader pressure to see, okay, what's going on? And as I'm touching around the ear, it's like, oh, I can feel more specifically where it is. So the broader pressure you use, you'll really be able to tell in a gentle way what is wanting attention. It's like, oh yeah, all that stuff in the ear, like right at the front, right at the back of the jawline. So I'm going to put some pressure there, again, gentle pressure, and then we're going to bring some movement to it. And oh, that spot I touched, it's just a little bit exquisite. So putting some pressure there and doing some movement. So we're opening the jaw, and you can see, you might be able to see some movement under my fingers here. So I notice that when I do that, as that space opens up under my fingers with the jaw movement, my finger wants to slide up and get a more specific spot. Oh yeah, that's it. Again, it's pretty gentle. I have an eye itch. Pretty gentle pressure. And what's great about that is we can really find the area that is more tender and be able to, feel that, address that, and not have it be a shock or so much pain that your body kind of shuts down, your nervous system kind of shuts down and goes into protection mode. So, okay, as I drag down, this is another way of doing it. So I'm putting pressure here and just dragging down a little bit, so sliding over the skin. Slide it forward, slide it back. As I slide it back, the pain, and turn up a little bit, like a twist, the pain pretty much goes away. So this is myofascial unwinding, I like to call it. Positional release, myofascial unwinding, those two go together really well. So tender spot, I change the position of the joint to see what makes it feel better. When I shift my cheek, my jaw this way, that makes it feel better. And then I can slide the skin, that makes it feel better. So good. Like my eye feels really different. It feels like this dropping down, sliding down of the tissues around the inside of my eye. So finding the position where it feels better, finding, sliding the tissue to where it feels better. And then you hold it for about 90 seconds. And just watch. I'm just noticing wave after wave of release. And the connective tissue in the muscles, in the sensations in the nervous system. It feels so good. So there had been just a really minor headache. And most common for me, it's this right side. It's like here through the jaw, the ear. I think that's the most common for me. Maybe a little bit right at the back of the skull. And yeah, so about 2 minutes of doing that. It's pretty dramatic. I like to follow up because there'll often be another spot. It's like, okay, now I feel something in here. Right there. Pretty gentle, kind of broad pressure with the side of the finger. And I just repeat. I just do the same thing. I move my jaw. Oh, that feels so much better. It opens up the ear. Warm inside there. Warm, tingly. And again, now I'm feeling the waves like through my whole back of my head on the right. These waves coming down, waves of tingling, warmth. Feeling it all the way down to my ribs, feeling that warm, that tingling.